gosh, what happened to you? I think you injured your rotator cuff muscles. Are you in pain? How much is the pain score? Is there tenderness or is there snapping and crackling while you move your shoulders?
The rotator cuff is a group of muscles and tendons that surround the shoulder joint, keeping the head of your arm bone within the shallow socket of the shoulder. Injury to the rotator cuff may produce pain and weakness in the shoulder, difficulty lifting the arm, and snapping and crackling noises while moving the shoulder.
To confirm our impression, we must take shoulder x-ray to identify bone spurs and magnetic resonance imaging and ultrasound to examine the soft tissue and to identify the extent of the muscle tears. MRI or ultrasound to examine soft tissues including muscles and tendons for us to evaluate the extent and severity of muscle tears. Don't worry, I got your shoulders.
The following are the imaging modalities for rotator cuff. First, X-ray. Antero-posterior view helps determine acromiohumeral distance, which is narrowed in association with rotator cuff tears. An outlet view helps identify acromion shape and slope, while an axillary view helps determine the humeral head position in relation to the glenoid. The image shows an antero-posterior radiograph of the right shoulder showing calcific tendonitis as pointed by the arrow. The next image, moreover, is a superior dislocation of a humeral head. This is probably the result of a very long-standing rotator cuff tear with progressive cranioization of the humeral head and erosion of the acromion. Another imaging modality which may be ordered in rotator cuff tear is ultrasound. In this image, a transverse ultrasonographic view of the supraspinatus tendon showing an articular surface partial thickness tear which is pointed by the arrow. The overlying bursal surface fibers, however, are intact. In this next image, this is a transverse ultrasonographic view of the supraspinatus tendon showing a full thickness tear which are pointed by the two arrows, with fiber discontinuity, loss of a normal tendon convexity, and fluid filling the gap. And lastly, magnetic resonance imaging may be ordered. In this image, the rotator cuff tear is seen in the muscle. The muscle is lit up in bright white and you can see a dark spot indicating the tear. In this next image, this is a partial rupture of one of the rotator cuff tendons. The red arrow indicates the rupture site. Lastly, this picture shows a complete rotator cuff tear. The arrow is pointing to the area of full thickness rupture through the tendon.
Is there pain or burning on the outside of the elbow? Or do you have weak grip strength? I think you have lateral epicondylitis, commonly known as tennis elbow. Lateral epicondylitis refers to the inflammation of tendons joining the forearm muscles to the outside of the elbow. This is common among athletes who play tennis and other racket sports. To confirm our diagnosis, imaging must be done such as X-ray of the elbow for bones and MRI or ultrasound for soft tissues. Don't worry, I got your elbow.
The following are the imaging modalities for tennis elbow or lateral epicondylitis. First, radiography is the initial imaging study for elbow pain. Using plain radiograph, calcification in the degenerative tissue of the extensor carpi radialis brevis origin can be seen in chronic cases of lateral epicondylitis. Second, Ultrasound may show thickening of the common extensor tendon associated with diffuse heterogeneity and areas of focal hypoechogenicity. And lastly, MRI. This is the best diagnostic clue for diagnosis of lateral epicondylitis. An abnormal thickening and increased signal intensity within the common extensor region from the lateral epicondyle is shown.